Hey everybody, here I am. Sorry about post-conference yesterday. Good news is I'm in a hotel for the next couple nights while they try to fix my apartment up. So I wanted to give you a quick couple updates, even though we missed post-conference this week, about Meditech, and then also about our EBP paper that you're all starting to work on. Okay. So let's go ahead and jump right into the Meditech training. Here we are. We're going to go into cancer skin, open this chart. So I have this work list, and I'm going to just move this to 12 hours. And we'll go to full screen so you can see everything. Okay, so I wanted to go over provider to nurse instructions and call provider, and then also what to do with clocks around blood glucose and vital signs. We'll go ahead and cover the vital signs and blood glucose. So if you had uploaded, if the aide had already gotten the blood glucose, this clock is still going to be on your work list if they've done it from the AccuCheck machine and haven't manually come in here and clicked this. Another example is an upload at the vital signs, either yourself at the Philips upload, and then also if the aide had captured the vital signs for you and had already uploaded, this clock is still going to be here on Meditech. So I'll show quickly what we're going to do there on both of those examples. And a side note, if you still are not able to upload your vital signs machine when you're at clinicals next week, please call 625-5555 to get that fixed. That's the IT help desk at 625-5555. And again, I'm trying to move through all of this as possible, fast as possible. I'm going to convert this video in a low quality because I know it's going to be just slightly lengthy, and I hope I'm going to be able to fit it all on YouTube. All right, so here we have blood glucose and vital signs, either one. We're clicking, we're basically saying we have a clock. This information was already done. So with the clocks clicked, I can come down here to the bottom of the screen where it says not done. I'm just going to click on not done, and this menu pops up. And for these, I'm going to put in auto upload. So in other words, I'm acknowledging the clock. I'm just saying I'm not charting it from here. The data was auto uploaded. Hit enter, and we're done. Okay. So now call provider to nurse instructions. Sometimes you're going to see multiple ones of these, and it's important on each one that we always come over here and click the actual order in order to see what the order was. And so we always have to we always have to read these. Some of these are individualized, where the provider has actually gone out of their way to write something for you. You might find your wound care examples in some of these also. Sometimes they're related to hypoxia, sometimes they're related to changes in vital signs machines, etc. So let's say you've gone your whole shift. You haven't had to contact the provider. In other words, you want to acknowledge the clock, but you're not saying that there's a problem. So in both cases, again, we can just click the clock, or in this case, I'm going to click both of them. I'm going to go, again, not done. But this time I'll say lab value outside parameter. In other words, the value that the provider inputted saying contact me was outside. It's kind of confusing. I'm trying to do this as a screencast. If I'm calling the provider, it's because something is not normal. In this case, everything was normal. I failed to meet the parameters that I would call the provider. So I'm going to say lab value outside of parameter. And then that clears it. All right, good. Let me just sign off here because I have a lot of screens open. And we're going to go ahead and go to our next screen. So there's Meditech for us. So you guys are in a bachelor's program, and you may have heard the Institute of Medicine has a goal that by 2020, that 80% of the nursing workforce should have a bachelor's of science degree. And so the question is why? What is it that the Institute of Medicine saw in the nursing workforce that they wanted everyone to have BSNs? Well, it really relates to the fact that we know patients have better outcomes. And it's not really related necessarily, that I've seen in the data, different than the care that's provided by the non-bachelors. But where the bachelor's comes in a clinical situation is to be able to help lead a team through translating evidence-based practice. So what is evidence-based practice? Why do we want to do that? Well, we could always just keep doing things as nurses for decades, years, right? Well, this is the way Florence Nightingale did it, so why shouldn't we do it differently? Well, we should have evidence behind the care that we provide as nurses, and we should continually be refining this evidence and reviewing the evidence as new evidence becomes available. So this whole process is a sort of complicated process that we're going to go over a little bit, but you can read up on some of it. On this evidence-based practice, there's several different models, and my favorite is the Johns Hopkins models, but there's the Iowa model for evidence-based practice. There's several other models we can look at, but for this paper and what we're going to work on and what I want to do is I really want to introduce you guys to the Johns Hopkins Nursing Evidence-Based Practice Model. And the reason I want to do this is, I really think if you use Appendix E, which we're going to go over from this tool set, it's going to make writing this paper a lot easier. Once you read the article and do the work and setting out and grading your evidence, the rest of your paper is going to be really easy. And by introducing you now to this model, I'm really hoping that this will assist you later in the road. Unfortunately, when we're brand new nurses, we don't necessarily get to participate immediately in translating evidence into practice or evaluating new evidence. So it's a skill you use in school, you don't really use immediately after school, and then you're kind of forced to kind of come back and have to relearn this skill and perfect this skill in a real world environment. And so for that reason, I'd like to introduce you to this tool set, because I think as you go throughout your nursing career, this is a good one to use. Now, you'll be introduced to these other ones. Feel free to open up and use those, but I use the Hopkins model the most, and so it's the one I feel most comfortable teaching and answering questions, because I've used it in practice for multiple years, leading many different changes. All right, so you'll notice this is our section folder. I've uploaded a few things. I'll make a quick side note. We're just going to go into the calendar. I do have a calendar updated and uploaded for everybody. Hopefully we'll have to make very few changes now throughout the semester to our calendar. I will note one thing for next week. Go to the right one. I will note one thing for next week, which is week 6. We have our normal skills lab section and trait care from from noon till 2, and then there's the mandatory class-wide conference from 4 to 6. Oops, I got to change. All right, that's got to be updated. No, it's from 4 to 6. All right. Well, anyways, I need to hold our normal post-conference before the skills lab on Wednesdays when I'm getting to. Everyone should have that email. I should have fixed that. Sorry. Everything else should be into place. Go ahead and review. I'll be able to answer questions. Okay. So over here, you're going to notice I have a link to the Hopkins EPB toolkit. Go in. It's a free toolkit. They just need a little copyright permissions thing that they need you to take care of. We'll review that. But you'll notice I have the EPB guidelines for the paper located here in the folder. And we're going to review that one really quickly. So we want you to look at one journal article that is evidence-based research. I'm going to take from this the keyword research, and we'll talk about that a little bit. The one change I made in here is under these key points is, and we're going to go over the sheet, is the evidence grading. But you'll see there's in your paper using the APA format. Here is your headers. Talk about the key points from your article, the method or design that was used in the research, the population that was researched, the results of the research, what are the strengths of the research studies, and what are the limitations, and how can you use this information. So I'm going to give you a tool that is going to help you throughout your career, or introduce you to a set of tools that will definitely help you throughout your career, regardless of the specific tool set you end up using. But this adds rigor and structure to help you communicate and be able to prioritize and know when action is needed after reviewing the evidence. One thing I'm going to put, just a caution I'm going to say, and I'll give you a quick viewpoint here. For example, just on sleep, just on writing, looking at one article on sleep, there was 52 different articles, original articles eventually, that come out of this database. So I originally read 66 and 52 applied to the subject at our hand. So you will notice normally when we're doing evidence-based practice that you're not forming a decision about practice off of one article. This is a practice for you to first time read an article and then understand how would you draw conclusions from that. Just recognize in the real world, one article will never inform the practice. One article will never be able to have the depth that's needed to actually say this is the practice change that we needed. Now, Sometimes when we get into evidence-based practice and we ask ourselves a question and we research the question, we will discover that in the database, there really is no evidence to help us answer our question. And that's research. That's when we know we have a research question. And that's when we can contribute or have the opportunity to contribute new knowledge to the evidence base. But in this case, we're going to just start with the first simple skill of how do we find and select an article, and how do we begin to read it and draw information out of that article. Just understand that this is one small step in a very large process that we call evidence-based practice. Okay, so that's great. So you're going to go to Johns Hopkins, you're going to download this tool set, and you'll notice that there's a bunch of appendices. It's going to come down as a zip file. You're going to unzip it. There's a lot of these appendices in here. Notice that each appendix is both a PDF file and a Word file, so feel free to use whichever one you are most comfortable with using. Really quickly, I'll just review the overall model for Johns Hopkins. So normally we start with some sort of inquiry, a burning question that we begin to refine. Now in a real life, this is much more complicated. Almost always when we begin with our question and review our evidence, we end up coming back and refining our question. As we begin to learn and understand more of what's going on, we begin to refine and understand and clarify what is the population, what is that we're looking at. But notice that this is quite a circular activity within itself. So we have asking the question, evaluating the evidence, and then translating that evidence into practice, either creating best practices or recognizing that those best practices are already in place, and then we need to do something about the quality of the care that we are providing. Okay, so that's a quick overview of the Johns Hopkins evidence-based practice model. Now, for your paper here, because this needs to be a research study, we're only going to use Appendix E. So you're going to download this whole set, but for our practice, we're actually going to use just Appendix E. So this is Appendix B. As you download the set, this gives you an idea really quick of how you begin to develop that question. When you hear PICO questions, that refers simply to the population, the intervention, the comparison, and the outcome. For example, getting people up out of bed within 2 hours of surgery compared to patients who weren't, right? So our population could be surgical patients. The intervention is getting them out of bed, early mobilization, say within the first 2 hours of surgery. We could compare that to patients, same type surgical patients that we're going to let lay in bed for longer than 2 hours, and then we could compare their outcomes. So we might examine their pain, so how long they're going to stay in the hospital, so length of stay, the amount of opioids or medications or pain medications they use. We could look at the satisfaction of the care that they received at the hospital. So there's multiple ways that we could measure the outcome there as we look at clinical nurses, as we define that question, okay? So again, that's a whole nother homework, is just to begin to develop a PICO question. I just wanted to develop that for you. So somehow in your mind, as you are beginning to think about a research article that you're going to pull, you're asking yourself some type of question, hopefully informed either by something that you've seen within your clinical setting. Somehow that's a little grain. This is the nurse scientist mind working. There's this little grain about how is this the right thing that I can do, or how can I provide better care. All right, so out of all of these, I just want you guys to go to Appendix E. And the reason I say that is, if you'll notice that it's going to ask you, is this a report of a single research study? And if you said no, it's not a report of a single research study, it's going to take you to B. And it's going to ask you if it's a summary of multiple sources of research evidence. And if it says yes, you can still use Appendix E to grade your evidence, but the point being is you are no longer here evaluating a single research study. In order to answer your questions back here in your paper, to talk about a method and a design in a population, you must be going and looking for something that is a single research study. So if while using Appendix E, you're not answering yes right here, then you need to find a new article. All right. Now, in normal times when we're reviewing all types of evidence, say from expert opinions to literature reviews, things that are not experimental but add to our knowledge of how to provide better care, those you'll notice will actually direct you to Appendix F. And Appendix F is right here. And this is how you would begin to rate and level your evidence. So now in Johns Hopkins, you can have level 1, level 2, level 3, or level 4, or level 5, or level 6 evidence. Level 1 evidence is the most high-level evidence. And this is what we consider the gold standard, or the randomized control trial study. You'll notice is what's listed as a level 1 piece of evidence. Now, we could have a quasi-experimental, right, where the investigator has some control or manipulation of an independent variable, but we lack a random assignments to groups. The majority of nursing research you see out there really falls into this level 2. Very rare, in my experience, do I really find level 1 evidence in nursing research as it relates to a clinical setting, a clinical question that you're going to be asking yourself. Typically, in these RCTs, we're looking at drug development and therapy, drug manufacturing, and also medical device manufacturing. Now, I'm not saying it doesn't happen. There is times that you get randomization, but notice the difference between being an experiment or being quasi-experimental is whether or not you have this random assignment, okay? Now, it could be a non-experimental. So say you read an article that relates just specifically to a survey. You're just going to read an article about a paper survey or a survey tool instrument that was used either on patients, say for pain, fatigue, depression, etc., some sort of psychometric, or if you're looking at surveying an internet survey of nurses' opinions, you will notice that this is a non-experimental. So as long as you're answering yes here, you're going to have a level 1, level 2, or a level 3 evidence. All right. And that then you'll know you have an article to read. Now, again, the reason I'm giving you this tool is if you work through this tool, you're going to notice that it's basically writing the paper for you. And again, while I don't want formalized PICO questions, you should really sketch out here, what is the question that you're really trying to ask yourself? What is it that you really want to look at? Okay, so as we continue to the next page, so if it's level 1, level 2, or level 3, now it's going to give us a quality rating guide. All right, so it's going to give you some questions that you answer yes or no, and this is what's going to give you your strengths and limitations. Oh, one quick thing I should note. You can have there's quantitative and then there's qualitative experimentation. So in quantitative, we're looking to find something that we can generalizability across the whole population. Versus in quality research, we're looking for something that's recognizable. So in other words, anyone that has experienced a similar phenomenon should recognize something from the research. They should be able to identify with it. Not that necessarily the results from qualitative can be generalized to the whole population. It should be those findings will, if properly done, will be recognizable to people that have experienced the same phenomenon. Okay, and then there's mixed methods, which of course mixed methods is using both quantitative and qualitative. You'll notice this is section 1, quantitative. If you decide to use a qualitative article, we're going to go to section. Okay. Let me go back out here. Sorry guys that I'm doing this in our first pass here. So if you use a quantitative, see I didn't go all the way back to the first page, sorry. So let me go back to the very first page of Appendix E. The very first page of Appendix E is you're going to write in your article and you're going to say if it's quantitative or qualitative. If it's mixed methods, it's mixed. It has both quantitative and qualitative portions. In which case, if for mixed methods, you're going to do both section 1 and section 2. So going back, if it's quantitative, do section 1. If it's qualitative, do section 2. If it's mixed methods, do both. We're just going to look at section 1 really quick. Again, what is the question you're trying to answer for yourself? Don't worry about a formalized PICO question. I just want to see what it is that really is spurring you to go and look at the database. What's your burning question, right? You're doing your homework. Hopefully you're doing something that interests you. So there's a reason that this question interests you. Answer yes, or go to section 2 if it's qualitative. As long as it's a single research study, when you answer them, go ahead and you have an article that you can continue with. When you go to the next page after section 1 or section 2, this is going to help you with the strengths and weaknesses. As you answer yes and no, you're going to be able to identify both the strengths and the weaknesses based off of these descriptions that Johns Hopkins is giving you. All right, here's section 2 for qualitative. Is it a report of a single research study? Yes. We're going to do level 3. Notice Johns Hopkins always starts qualitative as a level 3. And if no, go to 2B. But again, for this, you need a single research study. So this must be yes for this homework assignment. Appraisal of a single qualitative research study. So again, yes and no. This is what's going to help you determine both the strengths and the weaknesses of your article. Was the sampling adequate as evidenced by achieving saturation of data? Right. So in qualitative research, we're not looking for that N like we are in quantitative. In qualitative, we're looking to continue to interview people until we're no longer hearing anything more. We've completely have been saturated by our population, our sample from our population. All right, now on both of the ends of these, we have A, B, and C. So we're going to rate it either as level 1, level 2, level 3, and then we're going to give it a quality, A, B, or C. And again, this is going to help you. This is the qualitative A, B, C, right? This again helps to you as the reader in your article identify what is the strength and what is the weakness of the article that I have before me. And it's in there. Yeah, go to quality rating for quantitative sections, study section. So here's for mixed methods, quality rating, A, B, C, for qualitative studies. So you'll see how those are in there. There's, I think mine, I accidentally deleted a page as I was working. Okay. So that is Appendix E. So what you're going to do is you're going to find your article. You're going to download a copy of your article because you need to submit that to your Dropbox. Then as you read your article, I want you to work through Appendix E to A, help you identify that you actually have a single research study article, and then B, to help you identify the strengths and limitations of your article in front of you. Recognizing that you don't make practice changes based on one article, based on the information that you have learned within that article, then within that last section of your paper, you're just going to describe to me what would you feel is your next steps. Is this help? Does this support? Does this change your mind somehow? Does this in some manner continue to refine your question? Or in some way, does it help you identify the fact that there's a possibility to change care and you need to go out and get more evidence, gather more evidence? Hopefully that makes sense. Again, I'm available. We can talk about this again next week during our post-conference. So you can send me some emails and I can answer those over the weekend even when I'm off of work. So hopefully this has helped you and this is going to help make the paper easier. I would like you to go ahead and fill out your Appendix E and submit that. So when you go to your Dropbox to submit your assignment, I want your original article because I need to be able to look at your article to decide or give you feedback on your conclusions and if you're concluding the right information. Your paper, which is supposed to be in APA format, and then also your Appendix E filled out for your paper. So like I can give you an example. If I go into here and I go into articles for citation, I'm just going to pull up one here. This article I rated, I've put in the article title. This number 5 here just identifies that it's number 5 in that Excel file where I had all those articles. Put in the authors, the publication date, which journal it's on, the fact that it was a quantitative study. It's a report of a single study. but it was no, no, no. So that put me at level 3. Study findings that helped me answer my questions. We said we found a high level of anxiety and depression in intensive care nurses who worked an 8-hour rotation and also had a low income. All right, but again, for you guys, you can just kind of fill in here, like kind of how does this article apply to the question you were asking yourself there? And then I come in, I mark my quantitative research studies, these yes, no's. That helps me identify both the strengths and weaknesses. And then quality rating for quantitative studies, I marked as C. This was a low quality or major flaws. It had little evidence. It was inconsistent with the results. The sample size was insufficient for the study design, and the conclusions could really not be drawn from the paper. All right. So here this quality rating for quantitative studies is located right below this appraisal of a systematic review here. All right. And then I just matter. So you'll notice then in my database, I only had the pages that I filled out blank and leave them in there. You don't have to delete them, but just that's my practice as I go through and do these. It makes it just easier to print and find. I hope you find this quick screencast helpful in putting this paper together. I really hope you find Appendix E helpful and usable. Remember, find that link in the folder. Go get your permissions and download the folder and download the zip file, unlock it. And I recommend keeping this someplace on your computer, because as you go through the rest of school, I would really as you go through other classes and you're asked to do these kinds of things, I think you'll find this tool very helpful in helping you identify strengths and weaknesses. What is the level of this evidence? What does this really tell me about practice? Is it meaningless or is it meaningful? Really quick, I'm going to tell you about one thing in case you guys don't know about it as it relates to the APA. Again, using the APA format. This is Purdue. This is the Purdue OWL online writing. This will help you with in-text citations, creating reference lists. Just keep in mind that this writing lab has multiple guides. So make sure, because sometimes if you go to Google it and you just click a link out there, it doesn't take you to this homepage. Sometimes you might click a link that accidentally takes you right into the MLA guide, and then you formatted your whole paper on MLA rather than the APA guide. So always make sure that you get into the APA. There's a style introduction, overview, formatting, and style guide. Okay? And usually you can tell, because wherever you are over here on the left hand, it will tell you if you're in the APA and the MLA Chicago AMA. Thank you very much for your time. I hope you all have a good weekend. And I really believe that Appendix E is going to help you. And this is really the beginning of the journey. This is why you're in a program like this at Washington State University, why we need more nurses trained at this bachelor level, is to affect changes in our populations. So outcomes as it relates to populations, we do that by translating new evidence into practice. Thank you for your time.